So, hello everyone, I'm David Lillicrap. I'm a professor in the Department of Pathology and Molecular Medicine at Queen's University in Kingston in Canada. And I'm going to talk to you for the next 2 or 3 minutes about a presentation that we gave at ISTH last week relating to one of the treatment complications of hemophilia gene therapy. So as most of you will know, I think that one of the more frequent complications that we see following the delivery of AAV vectors for hemophilia gene therapy is an elevation of the liver enzymes, particularly alanine transaminase levels, which occurs in actually about 80% of individuals and requires some form of therapy to reduce this problem. And so the study that I'm going to summarize very briefly for you is presented by Paul Batty, a postdoctoral fellow in my group. And in this study, which involved 7 dogs with hemophilia, we infused the dogs with an AAV5 vector. And then the study was set up that we look at the early study outcomes over the first 12 to 18 months. And so this study has now reached about 18 months or 2 years of maturation. During that time, 4 of the dogs have expressed therapeutically useful levels of canine factor VIII using this AAV5 vector, which carries the canine factor VIII cDNA. But what I want to report on in this presentation is that one of the dogs developed 2 episodes of alanine transaminase elevations at weeks 11 and 17 after vector delivery. One of those peaks was up to 400 units of ALT, and we were able to get liver biopsies within 2 days of that peak elevation. The liver biopsies were actually pretty unremarkable. They didn't show inflammation, no fibrosis, no scarring. They essentially looked pretty normal. And when we looked for signs of apoptosis of the cells or evidence of cellular stress, ER stress, we didn't see any evidence for that at all. And so these elevations at the moment remain unclear what their pathogenesis is. This is an important question because many of these patients are put on steroids or other immunomodulatory agents for multiple weeks. And so this mystery, which after this dog study so far remains without an explanation, and we need to do more investigations both in preclinical models and in patients to understand why this happens and what is the best way of intervening to prevent the loss of transgene expression from the transduced hepatocytes. And so with that, I'll finish. Thanks for your attention and look forward to seeing you at future meetings. Thank you.